Hello and welcome to another episode of The Fulcrum here at the Virginia Dental Association. It has been a busy 2026 to say the least. We are off to a fast start and we got started pretty close to the new year with Lobby Day, our dental days at the Capitol with our reception on that Thursday evening. Had a great turnout, had a lot of students joining us from VCU Dental School, which was very exciting. And then our morning, we headed over to the General Assembly and were very effective at our lobbying. With me this episode, we have Paul Logan.
Hey, Paul. Ryan. Glad to be here.
Glad to have you. We are talking all things General Assembly. The Lobby Day was a huge success and laid the groundwork for our legislative initiatives this upcoming General Assembly. And they are currently underway, and we have some good things to update everyone with on that front. But there's also just a litany of bills that definitely impact dentistry or your business or the cost of doing business. And so we spend a lot of time talking about those today and where those are in the process. So diving right in. This General Assembly has about two weeks into it, 2.5 weeks, and we are seeing a lot of bills pop up. A lot of ideas, some of which are great, some of which are not. One of those not so great ideas that we were pretty effective at beating, Paul, was a fluoride ban.
That's right. That's a bill that we have seen coming up in other places in the country. The VDA had a long-standing policy in support of community water fluoridation. Virginia, as you look across the country, is one of the states that has the highest level of water supplies that are fluoridated. We're in the 90% plus, and it's also something that we have members who are very passionate and those who have practiced for a long time, who've practiced in areas that did not have community water fluoridation and can tell you stories about the difference in dental disease they saw at the time and what they're seeing now. So we were there in committee when the bill came up. Thankfully, the House committee that considered it decided not to move it forward. Right. But that's something that we have also seen in individual localities, because in Virginia, they make the decision. So we are part of a group of advocates who are continuing to watch what is the discussion happening around the state so that we can be responsive and make sure that those decisions with respect to community water fluoridation are made with a full knowledge of the facts.
Yeah. And it's another example of the Dental Association standing vigilant for the overall oral health of the Commonwealth. And that has never not been a priority of the association. Part of that access to care, making sure everybody's oral health is maintained, can also be seen in another issue that is a discussion to cap the Medicaid funding. And it's in the budget to have a $2,000 cap on adult dental Medicaid. And we have been pretty active. The governor included that in his budget. That was sent down to the General Assembly. A unique thing about Virginia, an outgoing governor, before he leaves office, sends a budget to the General Assembly. Now, they don't have to accept it, and nor do we think that they will accept this. But we've been working lockstep to make people understand that putting this $2,000 cap on the dental work that they would receive would really have an adverse impact to the momentum that honestly our Medicaid program, while still has work to be done, it stands heads and shoulders above a lot of other states.
And that's right. I think about 5 years ago when Virginia added the adult dental benefit in Medicaid, and then a few years ago when Virginia added a reimbursement rate increase, the proposition behind that is Medicaid is not going to pay you what your fees are in your practice, and it is still lagging in many cases behind private insurance, depending on the procedure. But the distinction in Medicaid is there has not been a cap. So you can at least know that you will be able to provide the full range of services. So to say that it just would not work to be able to say, well, you can get part of your treatment this year, but not continue it. So that's something that I know Dr. Hairston, as he's spoken with our members about the benefits of participating in Medicaid and seeing that population, that's been a very important selling point for getting more dentists involved. But today we have about 500 more dentists participating in Medicaid than we did before that increase took place. We know that dentists are responsive to, can I do this while also keeping my doors open?
Yeah, absolutely. And Dr. Hairston and Justin at the program there, they've been really great to work with from our standpoint and genuinely want to see it be successful. We know that this is not something that's going to take the program forward, but we also understand that there's a huge deficit inside of the Medicaid program. Not the dental program, but just Medicaid as a whole. And so everybody's looking for places they can find money. They've got a balanced budget requirement by statute in Virginia. So they can't run a deficit. They've got to find the money from somewhere, or they have to raise it from somewhere else. And that's also another unpopular thing as well. So again, we're standing vigilant. We understand is not the direction or the momentum we want to have related to the program. Nothing in the General Assembly seems to be saving anybody any money in their private practice or in their private place of business or in their home. And so, we're constantly reviewing, looking at, and trying to push back on things that just make it harder. And one of those that comes up every single year is the medical malpractice increase. Again, this is a bill, we actually have a current action alert out about it. We've had quite a few dentists and dental team members sending letters asking them to oppose this. It does cost the state money. It has a fiscal impact as it is applied to not just private practice, but it has to apply to the state as well. And so the cost of providing care is going to go up as your med malpractice goes up. So again, it is something that comes up every year. Not sure really where it stands this year, although we've made a pretty good appeal, right, to Senator Stanley about not wanting this.
No, that's right. And we have an active action alert. If that's something that you are willing to do as a listener, you can go to our website at vadental.org. We'll include it in the show notes. But just to send your legislator a message letting them know that this is something that would increase the cost of healthcare for patients in Virginia.
Right.
And increased costs could also impact practitioners' considerations to treat patients 10 and under if you have this narrow bill.
Right.
And that's not something we want to see in Virginia. As we're thinking about something that would particularly impact pediatric dentists or oral surgeons in Virginia.
Yeah, just to clarify, this med malpractice cap increase applies only to patients under the age of 10. They've negotiated that age, I think, over the years. And again, from the other side, they make the argument that, if something adversely happens to a young person under the age of 10, the cost that they're going to have for the rest of their life, if they live to be 80 years old, and they need care all the time, they're going to run out of the money from that med mal. And so these arguments are tough, right? I mean, there are personal stories that go to these things. And so it's very important, though, that your voice be heard so that they understand that there's a real life consequence to this that goes beyond just a practice's costs. But like you said, it goes into the ability to deliver care. That just is a trickle down effect to any of these increased costs.
Yeah, that's right. And about 15 years ago, the Virginia trial lawyers got together with healthcare providers, worked out an agreement with an escalating each year, a reasonable amount, because healthcare costs have increased. All costs have increased since 2010. The Virginia Trial Lawyers Association, important to note, did not request this legislation and supports Virginia's current medical malpractice laws.
Sticking to the agreed matriculation of the cap. So to those who have already sent letters to your legislators on that, thank you. And if you haven't, please take a moment to to go there. That again, it'll be in the show notes as well. So those are just a few of the things we've been opposing. There are more that we're watching. The list is long, but there are some other things going on that we're supporting, including the need for a budget item so we can get a new dental school at VCU, which is a huge priority for not only the Richmond area, but for the Commonwealth. I mean, it is the state's only dental school. And to be quite frank, I think everyone would agree is in need of an upgrade. That the facilities are aged and they're serving their purpose, but there's a lot of Band-Aids and duct tape and zip ties being involved in kind of putting it all together. We hear from the dean and his staff quite a bit about attracting talented professors and faculty to come to VCU Dental School is a challenge when you have facilities that just aren't state of the art or even of this decade. So it's something we're pushing for and advocating very hard. It has a high price tag in a year where the budget is tight, as we just talked about. So it's very important that we explain to them the importance of what the dental school does for the Commonwealth, how important it is, but also the impact it has on the greater Richmond area, and I would even say the state. Right. And they're the number one Medicaid provider of dental care.
That's right. The VCU School of Dentistry sees over 100,000 patient visits every year, and their impact is statewide. They have service learning sites and free and charitable clinics. I believe 14 around the state. Right. And one of the things I really just appreciated hearing on lobby day as I was joining some different groups for visits with their legislators was the personal stories from students about just the need for updated facilities, the growing role that the School of Dentistry plays in direct patient care. And just over the years since I've joined the VDA about 5 years ago, how many people I know in Richmond who say, oh, yes, I got care at the VCU School of Dentistry.
Yeah, same.
And it was great. And so they need just facilities that recognize that role that they're playing and can be ready for dental education and dental care going into the future. It looks a lot different than it did 70 years ago.
For sure. And they're going to be able to, with the new facility, be able to see even more.
Yeah.
I mean, that number is pretty astronomical when you think about it. But with a facility that's larger and able to receive more waiting areas that are larger, they're going to see more people and help more people inside of the actual clinic there. So pretty amazing. Something we're going to stay on top of. Been working closely with the school to make sure that the legislators know just how dire the need is. But nothing's easy, especially when you're asking for money. So that's why we need people aware of it and be willing to support it as well. Before we leave the budget items to go on to our major workforce initiatives that we've been pushing for, there is some allied dental funding, a couple items in the budget that we're supportive of. And so if you want to elaborate on those a little.
Sure. So the two main efforts we're looking at, there is one that is a pooled fund. The budget amendments being carried by Senator Todd Pillion and Delegate Rodney Willett, both senior members of the legislature, very well respected. That's a pooled fund that would support dental hygiene programs through the community college system. And most Virginia dental hygienists who are practicing today matriculated from a 2-year program in the community college system. And it's a pooled fund that would support schools that are expanding or schools that are interested in establishing a new dental hygiene program. One of the challenges we have with these programs, they graduate students. The Virginia Office of Education and Economics came out with a new update this week. Their dental hygienist median salary now in Virginia is nearly $100,000, $98,000 a year. And it's a tremendous economic opportunity for those students. They're in demand by offices and patients, but we just don't have the capacity in our current programs, and they are expensive programs to operate under the CODA restrictions. That is something that we feel is very important because establishing and expanding a program requires significant capital investment and clinic space, depending on how you're configuring that program. But that's something that they're moving forward that is very important, because as we look at our long-term workforce needs, we need to be graduating more hygienists, providing that opportunity, both to have more hygienists, but it also, we know there are a lot of dental assistants that want to grow their careers. And if they don't have that pathway to grow through hygiene, many of them are going to be leaving into a different profession.
Exactly. Yep.
The other effort, we've been working for several years now with Virginia Peninsula Community College, which until 2024 had a dental hygiene program. They put it on pause due to some economic challenges they were having in operating it. And we have been working with them to find funding, working with their president and deans. But they're also asking for funding to help support, but also importantly, to double the capacity in that program. Before 2024, they had a class size of 10. They believe they can expand that to 20. If they can do that, that would have a significant impact on the area. When you look at Tidewater, the closest 2-year community college program for dental hygiene is either the class of 5 at Germanna near Fredericksburg or out to Danville. ODU offers a great education for 4-year students.
It's a 4-year program, though.
But when you talk about the just deal for a student and being able to graduate with 2 years with the ability to practice dental hygiene, that's very important. And we would like to see that program back, to see those 10 chairs in the clinic used for patient care and for education.
And, and historically, it was a lot of VDA members that got together years ago to start that program because there was such a need. And they advocated, lobbied, and got that program started. And so there's a lot of folks in that area that are very passionate about it for a litany of reasons, but one being they had a large hand in getting it started. But no, those are great items to segue us right into our workforce discussion. I think, just to recap what a couple of those budget items on the Allied Dental Professional funding and opportunities, I just want everybody to know how much work the Virginia Dental Association has put into expanding hygiene. The programs that we currently have, trying to get them to either A, stay online, which one is just staying where we are, treading water. That's hard, as we just talked about with the Peninsula Community College, while also trying to convince some to expand their existing programs, whether it's community college or others. Also a difficult task, because it is a very expensive program to put on at a community college level, which is limited in what they can charge for said students. So we have had great success in maneuvering in some of those things, but it is not without challenges. And, we have great success in the Richmond area, which is what I would call a hygiene desert in a 2-year programs. There are none in the greater Richmond area. And the VDA, we sat down with Fortis, a private for-profit institution of higher learning, and made the pitch. They had hygiene schools existing, right? Programs in Maryland and in Georgia. And we just said, hey, here's the need. Has anyone ever approached y'all about doing hygiene? They have been unbelievably responsive, excited. They are going to be coming online in the near, 18 months or so, with graduating 30 a year is the plan. Maybe not right away, but that is the plan. The VDA has been absolutely in the corner of and supportive of expanding hygiene, but we're not getting anywhere. Fortis is a great example of something new coming online, and we're utterly grateful. But every step and turn seems like we kind of are taking it on the chin, whether it be the Peninsula or other. There's dental assisting programs that are talking about going away or freezing or reevaluating. It is difficult.
No, that's right. And part of it is just how the community college system is structured. And broadly career and technical education courses that have traditionally been subsidized by other courses like your English and economics classes, your general education classes. But as community colleges face rising costs,
Sure.
the place they look to cut are those high cost CTE courses to help balance the budget. So speaking with a lot of the program directors, they feel like they're on the chopping block year after year and constantly justifying their existence.
Right.
And we know as people in the dental world how important it is to support those programs and those graduates. But when you have community college presidents making those decisions, looking at saying, well, I could spend this money and have several hundred graduates here or a handful here.
Right.
It's a math problem that is hard for them to solve with the tools they currently have.
Yep.
Now, that said, we have been in discussions with VCCS, other parties about like, how can we make that math problem easier for you?
Who else is having those conversations with VCCS, Paul?
So other health professions within dentistry, that's a good question. I think that was a rhetorical question.
It was a rhetorical question. You're exactly right. There is really no one else out there advocating for the expansion of hygiene except for the Dental Association. And so to somehow think that we don't support hygiene is just not the case. I mean, the proof is in the pudding. We're very much not in opposition to hygiene. As an association and individuals very much support and understand how valuable and key it is and are actively asking for more money, more spots, new places to start. And we're the only one beating the pavement to do that. And it is true. I mean, we've long said the Dental Association speaks for the profession. It speaks for the oral health of Virginians. And that's true. And I think nothing has been more evident of that than who do people look to when speaking about these things. I mean, it is on us. We wish others would take a larger part in their own profession, right? To help ensure that more are graduated, more spots are available. The demand is there. The demand is absolutely there for more people to enter into the hygiene field.
And just going back to points we discussed earlier, the VDA is supporting community water fluoridation. That is not necessarily in the best economic interest of our members, but our members got into this profession to address dental disease and help keep people in their communities healthy. What they want to do is practice a preventive model of dentistry where they have patients coming in and they're addressing problems earlier. No dentist in Virginia wants to tell patients no. No dentist wants to say, sorry, your Medicaid benefit only covers a portion of your treatment. Right. They want to tell patients yes. And the position that so many of our members, particularly in the Richmond area in Northern Virginia, are telling patients, sorry, you're going to have to wait 12 months, 18 months for a new patient appointment. Yeah. That puts them in a position they wanted to be able to treat patients, grow their practice. And right now the bottleneck is in those preventive roles. And they are looking at ways to how can we address this? Because it's one thing, growing the programs, expanding graduates is the long-term solution, but it's going to be a very long time, even as those initiatives are successful, until we see them
come to fruition
and in the workforce.
And I think that is the point of just kind of setting up before we talk about the workforce bills is the VDA has been tirelessly advocating for, and will continue to, the expansion of more hygiene programs with graduating seats, and specifically 2-year. Nothing wrong with 4-year programs. We totally support those. But the 2 years where we're really lacking, that's where it keeps, honestly, it's shrinking instead of growing in a time where we've explained that we have an actual crisis. 1,000 could be hired tomorrow and could be absorbed into the market. And yet we're graduating 135 a year, 150 on best. After attrition, 135. You're never getting out of this hole. And so the things that we're doing on workforce are not in replace of those things. It's in addition to, and we're not going to stop advocating for more seats and more hygiene spots across the Commonwealth. But the leadership at the VDA has gotten behind 2 workforce bills, and we lobbied pretty well with them at the General Assembly during Lobby Day and Dental Days. There are 2 bills. We've talked about them quite a bit, but we'll update you on where they are right now. One is the internationally educated dentists who have an expedited path to become a hygienist, right? And then there also is our dental assistants 1 and 2 being able to scale and polish. That bill had a substitute put in that the VDA was supportive of. It did a little bit of clarifying. It narrowed the scope and streamlined things to where it really is a certification program now for scaling and polishing for a dental assistant 1 or 2 to be able to do that on healthy teeth in the Commonwealth. So those 2 items were put forth to basically get us through as we try to continue to advocate for more hygiene schools, programs, seats, whatever you want to say. So Senate Subcommittee, Education and Health, in their subcommittee, those bills were up. The internationally educated to be expedited path to hygiene passed unanimously. There was some discussion about it, but the discussion was rooted mostly around this is a may grant, meaning the Board of Dentistry may acknowledge where they were internationally educated as something they acknowledge is legitimate, but it leaves that up to the Board of Dentistry to say yay or nay on this specific international form of education. And they can say yay, they can say nay. It's not a shall, it's no right to it, but it is offers, and then it offers an expedited path. And that path is the part that is
that maintains the same
exactly
licensure exam you would take if you went through the CODA path. It doesn't change those requirements, but it says the board can consider your international education as fulfilling the education portion of that requirement.
And you can now sit to take the test. And if you pass the test, then and you've met the board's criteria. So there was discussion there, and the discussion was, hey, we've done this in a lot of other professions and fields, and so that ended up passing the subcommittee unanimously. And then we also had our dental assistant scaling as well. And after the substitute, there was some discussion regarding that, but it also passed out unanimously.
Appreciate the member dentists who showed up
Yes.
and testified.
Had a great
spoke
show
with their legislators and were present to show that this is something that's important to them. But I also appreciated the testimony from Senator Locke, who is the sponsor of that bill, and just shared her personal experience. And like, we don't have to educate lawmakers that there's a challenge in getting into a timely dental appointment, because they're feeling it just like
their patients too.
Your other patients are.
That's right. Yeah, no, it was a good discussion. There were a few things that were corrected when it comes to understanding what is trying to be accomplished there. And I think our dentist who testified, and we had a great showing. I mean, we had probably over half of that room were full of our VDA supporters, which was fantastic to show that this was something impacting a lot, but having a real testimony from the trenches as to the fact that if you cancel your appointment, it's going to be a year or more before you get in to be seen. And cancellations happen, right? And so having that explained was very compelling. And that's the end of the day. Like you said, it's very much something that hits home because people are experiencing it, whether they're a senator or whether they're any one of your other patients.
Yeah. And I think an important piece of this is that all of these legislators have been hearing from their member dentists at home, whether it's through the VDA's Action Alert or through dentists who know them personally, and have helped them understand the dynamics. And just all of the efforts that have gone into trying to address workforce challenges and the thoughtfulness that's gone into developing some measured near-term policies that can help address those challenges.
I've used that word a lot over the past 6 months or so, because I do think this is a very measured approach to just say, hey, here's a way where we can have an impact pretty quickly and is not going to replace anyone on the dental team and can actually help move people up to the top of their license and the top of their abilities and what they're trained to do. And really, if it's going to function at a high level, it has to be that way, right? The scopes are there to help everyone get to the top of it. If everyone is only focused at the bottom of the scope of their practice, it's going to be difficult.
And that's something we can include this in the show notes, but Johns Hopkins had a study about 10 years ago looking at the Indian health services. They call them periodontal expanded functions dental assistants that are permitted limited scaling, and just the impact that had on clinics and practices where they were deployed. And they found not only were they able to provide more of certain procedures in those clinics, but they also found that the dentists and hygienists in those clinics were performing more advanced procedures, and presumably because they were freed up to do that.
Yeah, absolutely. I mean, it makes a lot of sense. And we knew this path was not going to be easy. It has been a large education process along the way, trying to educate a lot of dentists, a lot of legislators. It is a process. But it's one that, like I said, I think is a measured approach. And then it is a long way from over, right? So both these bills come up in subcommittee and they moved on unanimously. So next steps, there is also a companion bill for each one of those, meaning they're exactly the same. And they will be up on Thursday of this upcoming week. I know you may be listening to this not in real time, but that is going to be on February 5th. We will have that committee hearing for the House side of things. So what can you do to be helpful is to continue to engage and to reach out to your legislator. Let them know that you support the actions here that these two bills are trying to accomplish, not because you're anti-hygiene. Neither is the Dental Association. Very much actually pro-hygiene. But these two measures do give us the ability to meet the need to access to care that is before us currently, and in a faster fashion than any new school coming online or getting a school back open that may have closed, which is something we're going to continue to push for, but they're like turning a battleship in the James River. You know, it's difficult to say the least. Anything else they could do?
Sign up for VDA text alerts. You can go to our website on the communications tab. Do that as we have opportunities. We'll be sending something out ahead of a committee saying you are in their district and they need to hear from you.
Yes.
But signing up for text alerts, putting in your address so we know where you live. We have a great government affairs team that works very hard on our members' behalf. But they also want to hear from their constituents, and their constituents who are dentists are trusted members of the community.
Right.
And seeing someone with an address that's in their district who's reaching out, telling them what the workforce challenges look like in their district matters.
No doubt about it. Firsthand testimony from those experiencing it every day, always more valuable than us summarizing it secondhand, right? And I think everyone can understand that process, but just can't understate how important it is for that action to happen. So please take the time to sign up for our action alerts. Look for our emails that are coming. I know everybody gets a ton of emails. Share the podcast. We're going to try to keep you up to date. Things happen so quickly. Like if we had recorded this on Monday, what we're saying right now really may not have been.
It feels like we've lived about 6 months in the last month, and
yes, for sure. But all of which, to show what the value is here for your membership, where the VDA is on these things, and all of those items that you don't see behind the scenes on the legislative front, specifically as we talk about this episode. A lot of work goes into making sure something like a fluoride ban across the Commonwealth, that doesn't go through. I know that people are like, oh, that'll never go through. Well, if no one opposed it, it very easily could,
Right.
And that's the importance of having a voice, making sure that your members and your voice is heard. That's what the VDA does. And we're grateful and thankful for the opportunity to wake up each day to do that and to speak with clarity as to what the oral health of Virginia and how important it is. So with that, I know this was a long episode for the Fulcrum, but there is so much going on, and then we'll have so much more to share in the coming weeks. But we appreciate you and thank you for your membership and for your advocacy along the way. And with that, we will wrap up another episode of The Fulcrum.